Now we're going to talk about sleeping, and I'd like to welcome you again to this video series on posture. My name is Stephen Hamlin with mybodycanlearn.com, and I want to make a couple introductory comments about the bed. Now, Moshe Feldenkrais said the human body is mostly about human movement, balancing in gravity, learning to coordinate. The brain is mostly about that. So when you look at a bed and how we sleep, considering the whole body, the soma, the movements, the positioning, the breathing. People who have insomnia for years, who have chronic pain while they sleep, I've seen it go away in a day or two or right away just by positioning the body a little differently, using these ideas we're talking about common sense, posture. And particularly, I want to mention that the thickness of the bed is a question everybody has. Do I want a hard bed or a soft bed? And the answer to that is there is no answer. It's an individual thing. You have to find your own comfort level. And there's a misconception. People think if you have a hard bed, you're going to have a healthy back. And one of my Feldenkrais trainers, Ruthie Alon, told a story about that. She said, in ancient Sparta, the young boys were trained to be warriors about age 8 or 9 or so. They went to a warrior school until age 20 or so, and they were able to sleep on rocks and fight with swords and all these things they do. But when they were with their parents up until age 7 or 8, they had a soft feather bed. And then they go to the warrior school, they still had a soft feather bed. Every year, the feather bed was a little less until by age 18, they were on rocks. So they were trained every day in martial arts, in movement, posture, breathing, intensively trained for 10 years or so, or 5 years, whatever, to be able to sleep on a hard bed. So it's a learned skill. It's not something you just get a hard bed and lie on it. And the rule basically is, and this is from the Feldenkrais method, and it's based on thousands of people over many years with hundreds of practitioners have verified this. Usually, the more injured you are, the softer the bed you need. If you have a lot of pain, if you have a car accident, when I had a full extension whiplash, I had to have a water bed. It was the only bed I could sleep in without pain, and nothing else would work. So, with that in mind, you can think about getting a harder bed slowly and work into it. You can go to a department store and get this foam that'll go on top of a bed if you need a softer bed. So I would recommend buying a harder bed, get foam on top, and then peel the foam off and see if you can get used to it. It takes time to get used to a harder bed. Let's now move into the sleeping positions. We'll have someone lie on the table. Alana, would you like to come and lie on the table? There's a whole lot of things to say about how we position ourselves. Now, we want to be comfortable. One of the things is you can see there's a little stress on the hip joint because the knee is pulling it down. And if we had a cushion between the knees, that's a very easy thing to do. Usually a down pillow is best, but something to take the pressure off the hip joint when you lie on the side. Now, the next thing is something that it's so important that everybody should know this about lying on the side. Whenever you lie on the side, if you don't know this, your life won't go as well. You're going to have a lot of trouble. Here's the thing. When I'm standing, my feet are under me. My back muscles are tight because if my back muscles weren't tight, I would collapse. So when do the back muscles relax? The back muscles only relax when we curl in, like in the fetus, in the womb. Curl. In fact, in the 1950s, there was a doctor who had a radio show in LA. I forget his name, Brady. He wrote a book about his medical wisdom. And he said he would train people, if they were able, to do a forward roll, medical patients. And those who could do a forward roll with pillows on the ground, they had their medical conditions clear up more quickly. They were healthier. They breathed more easily. So curling up, like we were in the womb, is a very safe, healthy thing to do for the back, for the body. So when the feet are under the body, it's like standing. So don't move, Alana. I'm just going to show. If I take a line down her back, it comes right to her feet. So her feet are like under her. With the feet under the body, this is like millions of years of evolution maybe, or at least our whole lifetime. Whenever we stand up, the back tenses. It's a deep reflex, a deep habit. Stand up on your feet, the back muscles tighten to stand you erect. So when we sleep, we want to give up all that. We want to take the feet out of standing. So don't help me. What it means is you take the knees and the legs and you move them like that. So you're a little more into curl position. You take the feet out of gravity. We call that in Feldenkrais. So you draw a line down the body. The feet aren't there. So she's no longer in standing. So when I have a client at my table, I'm going to work on them. I always do this. I take the feet out of standing because I don't want the person to have all these standing muscles activated. Neither do you if you're sleeping. It's a very simple thing, but take the feet out of standing, bring the knees up. So now that her feet are out of standing and her cushion is between the knees, we can pay attention to the back. Now, you can perhaps see from the camera that her back is just like standing, it's straight. So many people think, well, when I sleep, I don't want to slump because I want to have good posture, I want to have a straight back. The problem with that thinking is the muscle, again, the simple thing about muscles, this is a muscle between my fingers. The muscle can do two things. It can relax, come to its full length, or tense and tighten, shorten. That's it. And the muscles coordinate in a beautiful way in the body. But the back muscles, when they're tight, they're short and tight now because this is what the back does to stand up straight back. So what we want her to learn to do slowly is to be able to curl the back so she goes more like into fetal position. And this will allow the back to start to relax in sleeping. So what I usually do with clients, we would start with the head. Bring the chin in just slightly, yeah. So this starts the back rounding, and we can put you more on your side. So to curl the body, I could perhaps show it by pulling the blanket like this. So you want a little curling of the back, like that. And the head can go back on the pillow if you want, like that. So here we are. We tuck the chin. We kind of curl the upper body in. So there's a little bit of softness and roundness like this. Not a lot. The back is still kind of straight. And it may take her time to learn to round here. Because we all push out the low ribs here. You can feel how these are pushed out a little bit. This is how we stand too much. We want to have these low ribs curled in. When you lie on your side, it's important to know that the pillow, the weight of the pillow should be on the ear or behind. Because if you have pressure on the face, it can distort the cranial bones. So when you lie on your side, try to arrange it so that the weight of the head is here, not on the face. That's it. Just a little adjustment like you did, you can change that. So I do that all the time. Make that little adjustment when you're on your side to make sure the weight is going like that. And you'll sleep better. Your face will thank you. You won't get so much distortion of the wrinkles and all that in the face. So at a Buteyko workshop, there was a student who came in and he couldn't lie on his side. He had sleep apnea. And sleep apnea is worse for most people when they lie on their back, as you know, perhaps. So when you lie on your side, it's easier to breathe for those with sleep apnea. He couldn't lie on his side because he had such pain. I just showed him this in about 2 minutes. I had to bring your knees up, tuck your chin, round the back. He came back the next day and he said, all my pain is gone. I can sleep on my side. Just like that. The material presented here is for information only. It summarizes the main tools that I have personally used for about 25 years as a Feldenkrais teacher. I've worked with many clients with serious medical issues and other people, and I found these ideas are safe and simple. They're effective, but common sense dictates that you need your doctor's permission. If you have any questions, if there's any pain, you shouldn't do a movement. You should always be gentle, go slowly. If you have any doubt about the safety of a movement, respect that and don't do it. You can see a professional teacher of movement, an Alexander or Feldenkrais teacher. These people are very good. They've studied posture for a lifetime. You can trust them, and they can look at you, and in a glance, they can tell you what is going on in your body and what you need to do particularly to help yourself. And this can save you many years of futile effort and struggling, doing everything or trying to accomplish something you don't really need to accomplish in the way of posture. When you have a professional, experienced person looking at you and you follow their advice, it can save you lots of effort and time.